Strokes are the fifth leading cause of death and number one cause of death in the United States. Risk factors that can lead to strokes include hypertension and high cholesterol. Smoking, a lack of activity, along with obesity increases a patient's chance for a stroke. Strokes are more common in patients who smoke, over the age of 50, and those who have a history of a previous stroke. African American males are at a higher risk for a stroke. Strokes can be explained as brain tissue death due to insufficient blood flow. When the brain cannot get adequate oxygen and nutrients, the cells cannot survive. A stroke can be categorized into two types: ischemic and hemorrhagic. Ischemic strokes occur when the blood flow is blocked from reaching the brain cells. Ischemic strokes can be separated into embolic strokes and thrombotic strokes. Embolic strokes occur when a blood clot or plaque fragment from another area in the body travels to smaller vessels of the brain and cuts off blood flow. 15% of embolic strokes patients also have atrial fibrillation. Thrombic strokes occur when a blood clot forms inside of one of the arteries supplying the brain with blood. These strokes are seen in people with high cholesterol levels and atherosclerosis. Large vessel thrombosis and small vessel disease describe what kind of artery contains a blood clot. Transient ischemic attacks are brief blockages of the vessel blood flow that resolves itself within a couple hours. Multiple transient ischemic attacks can increase the patient's risk for a major stroke.
Hemorrhagic stroke occurs when a cerebral artery ruptures and can no longer bring blood to the brain tissue. It is less common than ischemic stroke, and only 15% of all strokes are hemorrhagic, but are responsible for around 40% of all stroke deaths. The causes are brain aneurysm, which is a weakness in blood vessel wall that causes the wall to bulge and potentially burst, as well as a weakened blood vessel leak, so there is no bulging of the wall, but it is still damaged and causes leakage into the brain tissue. In both instances, blood spills into or around the brain and creates swelling and pressure, which damages cells and tissues in the brain. There are two types of hemorrhagic stroke called intracerebral and subarachnoid. Intracerebral is the most common hemorrhagic stroke and happens when a blood vessel inside the brain bursts and leaks blood into surrounding brain tissue. The bleeding causes brain cells to die and the affected part of the brain stops working correctly. High blood pressure and aging blood vessels are the most common causes of this type of stroke. It can sometimes also be caused by arteriovenous malformation or AVM, which is a genetic condition of abnormal connection between arteries and veins and most often occurs in brain or spine. Subarachnoid stroke involves bleeding in the area between the brain and the tissue covering the brain, most often caused by a burst aneurysm. Other causes are AVM, bleeding disorders, head injury, and blood thinners.
Patients who have suffered from a stroke may present many different symptoms depending on which section of the brain was affected. In a non-clinical setting, the acronym FAST is used to teach people the warning signs of a stroke. The F stands for facial droop, meaning one side of the face is functional while the other appears to droop. One way to assess facial droop is to ask the victim to smile with their teeth. The A stands for arm weakness. Ask the victim to raise their arms. If one side appears limp or is weaker than the other, this is indicative of a stroke. The S stands for speech difficulty. Slurred speech is also indicative of a stroke. To assess this, ask the victim to repeat a simple sentence. Finally, the T stands for time to call 911. Time is of the essence in treatment of a stroke in order to prevent long-term brain damage. In a clinical setting, the National Institutes of Health Stroke Scale is used to quantify stroke severity based on the weighted evaluation findings. The brain controls every bodily function. Therefore, damage to the brain caused by a stroke can present itself in a multitude of ways. A few of the signs and symptoms of a stroke include, but are not limited to, slurred speech, loss of gag reflex, facial droop, hemiparesis, which is weakness on one side of the body, hemiparalysis, which is complete loss of function on one side of the body, vision loss in one or both eyes, loss of sensation, disorientation, confusion, and sleepiness. Signs and symptoms are often indicative of where the stroke has occurred.
Nursing diagnoses are used to provide appropriate patient-centered care for people that have suffered from a stroke. Possible nursing diagnoses for stroke patients include risk for ineffective cerebral tissue perfusion related to cerebrovascular impairment. Patients who have already had a stroke are at a much greater risk of experiencing a second. A second nursing diagnosis is acute pain related to physical injury, as evidenced by symptoms such as restlessness, pained facial expression, crying, report of pain, and narrowed focus. A final nursing diagnosis is impaired mobility related to an alteration in cognitive functioning, as evidenced by gait alteration, decreased motor skills, and decreased reaction time.
Some different testing to diagnose a stroke include blood tests that tell the care team how fast your blood clots, whether your blood sugar is abnormally high or low, whether critical blood chemicals are out of balance, or whether you may have an infection. A non-contrast CT can also be done. It creates a detailed image of your brain. A non-contrast CT may identify early signs of a stroke, but most importantly will exclude intracerebral hemorrhage and lesions that might mimic acute ischemic strokes, such as a tumor. It is also used in evaluation of acute hemorrhages because it produces good contrast between the high attenuating clot and the low attenuating cerebral spinal fluid.
Patient teaching for stroke victims is mostly directed at preventing further complications from their stroke. For patients with impaired mobility, it is important to educate about the risk for pressure ulcers. Ways to prevent pressure ulcers include cushioning bony prominences, keeping the skin dry, and changing position at least every 2 hours. Another important thing to teach stroke patients with immobility is to perform range of motion exercises. This helps maintain mobility, keep joints flexible, and reduce pain. A final thing to teach stroke patients and their loved ones is how to identify signs of another stroke because they are more at risk. Be sure to teach them the FAST method and the appropriate steps to take should the patient experience another stroke.
A stroke can be very scary for both the patient and the patient's family. When caring for a patient with a Christian worldview, keep in mind the saying, prayer is the best medicine. While most modern Christians believe and partake in the benefits of science and its treatments, they still believe that God is in control of it all and that He is the ultimate healer. Encourage your client, if they are able to speak, to discuss their feelings towards what has happened to them. Offer to pray with them and help them understand what has happened. You may also be faced with detrimental effects of stroke that leave a patient brain dead and their family confused and hopeless. For Christians, they may be confused as to why God would allow them to still be alive but not living. For others, they may feel at peace knowing that their loved one will go to heaven and no longer suffer. But what does brain death mean for Christians? The Bible shows a relationship between the mind and soul, and that God is in control of our eternal souls. He will keep it safe until it is ready to be entered into our new bodies in heaven. So in thought, it is not your brain that is going to heaven, it is your soul. Therefore, encourage the family to pray and try to give them a sense of peace about any decision they must make, but always respect their decision regardless of your own beliefs.